Hi everyone, Emily here with Gary Schaefer, author of A Family Story of Addiction, Death, and Recovery. Today we have Lisa Kaplan with us. If you'd like to introduce yourself.
Okay, sure. Hi, I'm a social worker at Henry Ford Maplegrove Center. I'm also a certified advanced alcohol and drug counselor. And at Maplegrove, I run the community education department. So what we do at Maplegrove is inpatient and outpatient treatment for adults who have alcohol and other drug problems. We've been in existence since 1981, and we are located in West Bloomfield on the same campus as the Henry Ford West Bloomfield Hospital, but in a separate building off to the west.
Thank you, and I'd like to add on to that. How I'm familiar with Maplegrove is when Eric became addicted, we actually sent him here, and Eric spent 10 days here, and we also took a class here, which I think Lisa can expand on further, that helped us understand as parents what Eric was going through, and it was very, very beneficial for us. So, but we're going to proceed with that, and we're going to talk about addiction and what it is.
Yeah. So, like Gary said, we'll talk about addiction today. Lisa, so with your knowledge and your background, what is addiction, and how would you say people either get into it or allow themselves to become addicted?
Okay, those are great questions. So first of all, addiction is known as, the medical term is substance use disorder. It doesn't matter if a person's using alcohol or other drugs, it's still the same disease of substance use disorder. And it is a brain disease, it is also a mental illness. It is recognized as a disease by the American Medical Association in 1966. It's the compulsive and habitual use of alcohol and other drugs. And of course, there's behavioral addictions as well, like gambling, overeating, sex, pornography, internet, shopping. So those process addictions or behavioral addictions are also trigger the same reward center in the brain as substance use does. So how do people get started? So many different ways. It could be that their family introduced it to them at a very young age, and when our brains are not fully developed until the age of 25. So if someone starts using early, it primes their brain for addiction. It could be peer pressure. It could be to self-medicate mental health disorders. It could be because of curiosity, just interest in checking it out. So many different reasons why someone would use. And then you asked how could someone let themselves get addicted? It is not a choice. And many family members think it is, because either you pick it up or you don't. That sounds like a choice, but it goes so far beyond that. Most people in America, would you agree, have tried alcohol once?
Yes,
okay?
Definitely.
Okay, and some liked it, so they tried it again, and again, and again, and again. But at some point along the way, people cross the line into addiction. They did not intend to cross the line. So why would they let that happen? And the answer is because the line is invisible. We don't know where it is, and it's different for everyone. But once you cross the line, you can't uncross the line. Once you become addicted, you can't become unaddicted. So when family members say this was your choice, it was their choice to use. It was not their to start and to continue.
Yes.
But it was not their choice to become addicted. Nobody would choose to become addicted any more than we choose to have cancer or heart disease or any other chronic illness.
I've read that one of the top 5 reasons, and you touched on it, is parenting, parent guidance, or parents' view on drugs and drinking, or the parents' use of drugs or drinking. So I guess, would you consider that like one of the main causes, that parents just don't educate themselves and understand where they're leading their child into?
Yes, I would agree with that. I also think that for many parents, they think, well, I did it when I was a kid, I'm okay now. So, it's what teens do. It's what they do for fun, and nothing bad's gonna happen.
And I hate to admit, but that was my view. It's like I drank when I was 11. Unfortunately, the drinking age was 18 when I was 18. So it was really bad because it was being brought into schools and everything else. So I kind of looked at it as, oh, this is a phase of life, and I went through drinking, and then I stopped drinking, and I kind of assumed that for my family, and that's not necessarily the case.
No, not for everybody. There are some people who are genetically predisposed, so there's other people who are like I said, self-medicating other issues, and so not everybody can stop as easily as you did.
Something that you mentioned was that the line between beginning to, choosing to use versus becoming addicted is invisible. I've never thought of it that way, and I think that's a really good way to
That is a good way to look at it. That it's that invisible line that you don't know at what point you become addicted to whatever your choice is.
Right. And family members are often quick to blame the person. Why would you let this happen? Why didn't you just stop? Well, if they could, they would. Okay, they can't because they've crossed the line into addiction. And one of the symptoms of substance use disorder, one of the criteria, is a loss of control. They can't control it anymore. At first, they controlled the drug, and now the drug controls them.
And that's what I learned when I came here, because we were so frustrated dealing with Eric and trying to get him sober, and going through that class that you have for parents and loved ones of someone. The thing that sticks out to me is they say at first when they use, it could be for pleasure or for whatever reason they pick, but then it comes to a point where they have to feel normal. They have to do it just to get through the day. And I heard stories of Eric that just amazed me what he would go through just to get through the day to get whatever he needed.
Right, because if you stop using or you use a lesser amount, you're going to have some very uncomfortable withdrawal symptoms. You're going to be very sick. Could be shakes, nausea, nervousness, sweating, physical pain, depending on what drug a person's using. Who wants to feel that way? Certainly nobody. So if they continue using, those uncomfortable symptoms won't occur.
Good point.
Yeah. So that kind of brings me into, getting onto the road of recovery and sobriety. When somebody is choosing to detox, what could that look like, and could it be dangerous to do that without medical intervention?
Oh, I'm so glad you asked that, because with alcohol and with benzodiazepines, which are the class of drugs that are sedatives like Xanax or Valium, people could die by detoxing themselves. We worry about high blood pressure that can lead to strokes and heart attacks, and we worry about seizures. So anybody detoxing off of those two classes of drugs needs to get to a medical facility. So here at Maplegrove, we have a detox program which patients participate in prior to entering treatment. But even getting to a hospital emergency department is the way to go. A person who says, oh, I've detoxed myself many times, I've been fine. No, they've been lucky. They might not be so lucky the next time. Now, what's interesting is you would think opioids like heroin, that would be very dangerous. It's not. It's uncomfortable. It's very uncomfortable, but you're not going to die from it.
So what's some of the other drugs or alcohol that could be difficult then?
Alcohol and benzodiazepines are the two that we worry about the most.
I also read on being the group of people that have come through Maplegrove, I saw some data that 90% of people who suffer from substance use disorder start before the age of 18. Does that seem pretty correct?
Yes, I would agree, because if a person starts using regularly before their brain is fully developed, they're putting themselves at a higher risk of addiction. They're priming their brain during those years. So when I talk to our patients about this and I ask them, raise your hand if you started using regularly before your brain was fully developed at 25, almost every hand goes up.
Yes.
So yeah, not surprised by
And that was with Eric. He was in 11th grade when he started. So it makes sense. But now I know we made a lot of mistakes when we started to see Eric going down this path. And back to my point, we thought, oh, it's a phase, he'll get over this. And we did all the wrong things. Treating him harshly to try and correct the behavior. And I know he was in full addiction mode at that time. His brain was already at that point where he needed to use it. Do you see the same mistakes with a lot of parents?
Absolutely. So don't beat yourself up about this. We don't know what we don't know. They don't teach how to deal with this disease in school. We're not born intrinsically knowing this. It's something that people have to learn. So that's why Maplegrove hosted those meetings that you attended. Prior to the pandemic, we had in-person programs for family members. Now, since the pandemic, it's virtual. So anybody, anywhere can join. And we have a skill building class, which are 6 different lectures to educate families on this disease. And then we take a break. And then we have a share family support group where family members can speak to one another, ask questions, share experiences, and gain support. So these programs are free and open to the public. Anybody who is interested in accessing them can either call me at Maplegrove, just call the front desk and ask for Lisa Kaplan, or go on our website and you'll see the links and you'll read how to join the family programs.
But probably most of those are already have a child or a loved one in addiction, or because you and I have talked,
Yes.
it seems like parents don't show up until it's at the point
Right.
of, what do I do?
Right. So when my kids were young, different generation, I felt that parents were more proactive about wanting to get educated for prevention. And now what I find after doing this work for many years is that parents will deal with a crisis. They're not interested in prevention. I don't know if that has anything to do with the internet. They have access to whatever information they need, but I don't know.
That's and that's why I'm pushing to educate parents.
Yeah.
And that's what needs to be done.
Yeah, I agree. I think prevention is very key.
Right.
Do you have any tips on how we can encourage parents to learn more about substance use so that they can help their child prevent going down that path?
So certainly communication, education from a very young age. And if you have a family history, they need to know that from a very young age. So while you're not going to educate a 2-year-old about using heroin, you are going to educate a 2-year-old about keeping their bodies safe and clean, eating healthy food, brushing their teeth, taking a bath. And as they get older, wearing a seatbelt, wearing a helmet. And then as they get older, choosing the right friends, learning how to say no, and then about smoking and drinking and family history of this disease. Because there are some kids who are going to say, well, I can't use because I'm at a higher risk. Other kids are going to say, well, I'm going to do it anyway and take my chances. But at least if they've been educated and they've been given a consistent message throughout their childhood and they know their family history of this risk, some people will make a better decision.
And I know they have people who go into to schools and share their story, but I've still seen data that too many 12th, 10th graders, 11th graders, the percentage of them using on a regular basis or just experimenting is still almost 1 out of 2, close to it, and I'm still shocking when I see data like that.
So I believe that a large part of that is because they're self-medicating mental health problems. Depression, anxiety, feels lousy. And if you don't know what to do and you want to feel better, what's the quickest and easiest way to feel better? Use a substance. The better answer is talk to your parents, talk to professionals, and get help. Professional help from a therapist, from a doctor.
And that's your area.
We try. I know, I do have some young teens who have disclosed that they've started vaping in 6th or 7th grade, and I kind of tell them, that's a quick fix, and that's easy, that's the easy way, but we need to make sure that we can educate and help them understand the possibilities of what their future could look like if they continue, and help them learn the safer coping skills so that they can manage long term without a substance.
So ideally, teaching them safer coping tools will solve the issue. But what I find is this generation of parents will tell you, I don't have coping skills. How can I teach them to my kids? So I think that's a huge issue. I know many schools' curriculums, they do social emotional learning. A lot of that includes social skills. I'm sorry, coping skills.
And I had a parent who lost a child say to me is that we teach our kids about strangers and other things in their life where addiction, alcohol, drugs is a stranger. I mean, we teach them everything else about be careful when you drive, be careful when you do this, think about where they're going to college, but sometimes I think the parents miss the boat on, I need to educate them as we have a genetic in our family where addiction is a high risk, or at least educate them on this.
And many parents will say, well, they're too young. They don't need to hear about that now. And the truth is they do. They do. And the other thing is that parents say, I don't want to plant the idea in their head. I don't want to give them an idea that they should start trying these things. And it's not the parents who are giving the idea, it's the peers.
Right. And back to your point, someone told me, goes, I think some of the reasons is back to relieve pain, whatever they may be going through, but also it may be their method to seek pleasure or joy.
Yes. It feels good for some people.
Right.
Okay, not everybody likes the feeling of being under the influence.
Okay. Now we've talked about prevention in a way, covering that base. What should parents do if they're in full addiction, if their child is in full addiction? We went to support groups and we didn't go originally, and we were handling everything the wrong way. And actually after we came here for that class is when we started to attend Al-Anon for us. And I know there's many support groups out there for us, but we learned to take care of ourselves and how to handle it, because you have to make some tough choices as a parent.
Yeah, you are so right. So we encourage in our programs that we offer here, we also encourage adult family members to go to either Al-Anon or Nar-Anon or Families Anonymous, Celebrate Recovery, Smart Recovery. Any program that's a good fit for them is the one they should be doing. But it's not just enough to come here once a week or to come to our virtual program once a week. We want them to do more. And what these programs teach is exactly what you said, how to take care of yourself, how to focus on yourself, how to understand this disease in a different way and handle things differently than most people would just normally do, which is, yelling at them, swearing at them, calling them names, telling them how stupid they are for doing this, maybe, taking away privileges. While that sounds like what most parents would turn to, because as parents, that's what we know, it doesn't work with this disease.
And I could attest to that because that's what I did. I mean, that was what I went through with my parents. When I did something wrong, it was like, oh boy, I'm in trouble. So as those were the tools, if you want to call them, that I used, and it was terrible. It just made things worse.
Right. So what you learn what we teach and what you learn when you attend these groups is you learn how to institute consequences that are natural consequences. You learn how to not enable. So for example, there are parents who would, have beer in the refrigerator even though they know their kids and their kids' friends are coming over Friday night. You learn how not to do those things. So yeah, it's a learning curve.
A tough learning curve.
And the other thing I want to mention is denial. It is so easy to be in denial. Who wants to believe my son is an addict, my daughter's an alcoholic, my spouse is, addicted to whatever? Nobody wants to even entertain that possibility. But denial keeps the disease progressing.
Well, that's what we ended up doing. Whenever Eric couldn't attend a family function, we gave some excuse. It was all about, I think the parents go through a point of shame of, boy, this is my family, and boy, this doesn't look good on us, or whatever it may be. And you keep on hiding it for a period of time, and then it progressively gets worse for them.
Yeah, and the reason people hide it is because of the negative stigma in our society against substance use. and mental health problems.
Would you say it's getting better though?
Yes, and I think we can thank the pandemic for that in large part. The silver lining of the pandemic is more people needed help and they sought help, and it became acceptable to seek help and talk more openly about it. So yes, I would agree with that.
Any other thoughts?
Trying to think, I feel like, we covered quite a bit.
Yes, we have.
Are there things that maybe we did not bring up that you feel is super important for us to discuss?
Do you want to hear about what happens in inpatient treatment and then what happens afterwards?
Sure.
Yeah, absolutely.
Yes,
Okay.
definitely.
Okay, so parents, if a family member can get their loved one into an inpatient treatment program, they have done their job. Okay, at that point, it's up to the individual. You can't enter recovery for someone any more than you can lose weight for someone, right?
Right.
But if you get them into a treatment program and they get medical care and nutrition and fluids and counseling, education, they meet a wonderful group of people who are struggling with the same disease they are, often what will happen is they will start seeing that recovery is possible and that yes, I do have a problem and I do need to address it. So inpatient treatment is the way to go for someone who can't stop using.
But they have to understand, as the parents or whoever the loved one may be, is that there's things you need to do too. It's not like you send them in here and they come out and they're good to go.
Yes.
It doesn't work that way.
Right, thank you for saying that. So substance use disorder is a family disease. Everyone is impacted. Not just the person using, but everyone in the family, grandparents, little kids, everybody is impacted. So everybody needs help. The teenagers in the family can get help too, and preteens through Alateen, which is a 12-step support group for them. So while the person is getting their own help, that's why we offer family programs. We want family members to get help. And our family programs, they can attend forever. Not just when their loved one leaves treatment, they're not done. They can keep coming. We have people coming for years to our program. But the bottom line is, ultimately it's up to the person. And they learn what they need to learn. They leave with a very solid aftercare program of what happens next. And now it's up to them to follow it. But regardless of whether they choose recovery, the family member can live a peaceful, happy life despite having this disease in their family.
I came to you with my book, looking for you to read some certain chapters that I had talked about it. And of course you've read my book. Does my book give a good indication of what this disease is like?
Absolutely. You hit the nail on the head. You were very open and honest about the mistakes that you've made, which most people are not that comfortable being forthcoming about. But I think that what it did is it's letting other families know that it's okay to admit that you're not perfect and that you needed to learn. So yes, I think your book totally depicted what happens with this disease. And you illustrated Eric as a really wonderful young man with a lot of hobbies and skills and relationships. And that's true too of our patients, is that they all are happy. They have happy things going on in life, and then the addiction took over. Yeah. And they can get back to that.
But it can turn in an instant if you're not careful. Now, Lisa has a addiction background. You've also read my book, but you don't have that heavy addiction background and what those families. What did you think? What did that you learned from my book?
A lot. I felt like I got an inside look to your family and what it felt like maybe as a parent to watch your child experience the experiences Eric was having. And then on top of, you touched on his siblings and mom and all, like just a wide range of Eric's life. And like Lisa said, like you talked about Eric in such a good, positive way that I think it reduced the stigma of what maybe somebody might look like as a person with addiction. and again, like Lisa said, like you weren't afraid to admit, this is what we did in the very beginning, and it didn't work, and it did not help him. So you talked through what you guys did to better yourselves as parents and learn about addiction and substance use, and how you guys did what you could with what you had to help Eric, by setting appropriate boundaries, treating him as a human and not somebody with addiction. Like I said before, it was just so raw, and so just there's almost like not enough words to describe the book well.
You know, I'm in an online support group for people who lost a child, and a lot of them are still in extremely deep grief after 4, 5, 6 years. And I think, from my view, I think we deal with so much guilt originally because what if?
Right.
You have so many what ifs that go through your mind. If maybe we should have did this, or if that didn't happen. But someone told me, even the what ifs, if you would have took a different path, you didn't know what path that what if was going to go through. So you can't think that would have solved everything. And thank goodness my wife and I sought therapy to help us through Eric's death. We sought therapy when he was alive, actively using. And it's just, I want to express to parents, and that's where we get into educate yourself, because you do not want to go down this path. You do not want to see your kids go down this path, or your spouse, or wherever it may be, because it is a disease that carries you for the rest of your life. You have to change your lifestyle for the rest of your life. Is that pretty much correct?
I would agree. And I think that that's a big part of Al-Anon, teaches having acceptance. So whatever is, accepting it. And it's not easy to accept the fact that your son or daughter has died, but it's reality. And you could blame yourself, you could feel guilty for the rest of your life, you could beat yourself up about all the things you did wrong, and where's it gonna get you?
Nowhere.
Right? So programs like Al-Anon help you to move past that.
I remember Al-Anon the first time I went, and I walked in there, and I was fit to be tied. I mean, I thought, okay, I'm gonna learn how to fix Eric.
Right.
And after not long, I says, this ain't what it's about. And then I says, how can these people be so much at peace with what they're going through? But then after I went to the program, I started to realize how to take care of myself. And I need to stress, Al-Anon is a program that it's a lay person who runs it. So, you know, if you don't like the group you're in, find another one, because there's a lot of them out there.
Right.
So.
And what you like, I might not, and what I like, you might not, because we're different.
Yeah.
Yeah. And there's more than Al-Anon. Like we said, there's other programs as well, but family members can really benefit from them. Many people go to Al-Anon and think, oh, they're going to teach me 12 steps to get my child sober. And that's not how it works.
No, it's 12 steps to help me get through life. Yeah,
right.
Exactly. So that's, go ahead.
Another thing is, this is a very isolating disease for the person using, but it can also be very isolating for the family. So the family needs to reach out and get help and support. And it may not be from their best friends or their neighbors, right? It's got to be from people who understand this disease. Because what a best friend might say is, well, Gary, you know, if you were a better dad, this might not have happened. And how is that helpful? Right?
Right.
So people who really understand this as a disease and can help you.
People who don't understand the disease, they'll give you suggestions on a behavior problem, and that's not where we're going.
Yeah. Why don't you just kick him out?
Yep.
That'll teach him.
Yep.
And kicking him out is not going to address the disease.
No. It may be a step depending on what's going on within the household with a boundary.
Okay, so what we teach is you're not kicking him out. He's making the choice to leave by not following your rules. Right?
Yes.
So we're putting the responsibility on them. So these are like subtle things that we teach in our program that make all the difference in the world. Because when you tell a parent, when a parent kicks their kid out, then they're the bad guy and they feel bad about it. But if the adult child makes the choice to leave by not following the agreed upon rules,
Those are
that's a different story.
consequences that we talk about.
Right.
We set up consequences
Right.
for, and that's what we did with Eric after
Right.
we learned.
Right. Yeah, and then even things like, taking away the car. If they're driving under the influence, they should not have a car. Even things like paying for someone's cell phone. If they're using the cell phone to access drugs or using friends, they shouldn't have a cell phone. Things like that, parents don't think about. They think every kid's got a cell phone. Of course I have to give them a cell phone.
We did struggle, Marlene and I, on different, because we weren't at the same level of what we wanted to do, and that was key, is that we needed to get on the same page. And a therapist told us one time, Gary, you're strict, Marlene, lenient, and as I would see what she was doing, I'd get stricter, and when she would see what I'm doing, she'd get more lenient, and next thing you know, we're doing this,
Right.
trying to address him, and they're smart, and they are smart enough to know what's going on, and they'll play their games.
Yes, they will. They'll divide and conquer.
Yes.
So one thing we teach in our family programs is how parents need to be on the same page. And if you're not, there's family therapy that can help with that. And there's also meetings. If you're going to meetings, learning the same thing at the same times, that can help with it. But it's really important in the presence of the young person to have a united front, even if privately you don't necessarily agree.
Yep. I think we covered a lot of good topics there.
I agree.
And this is a good video that people can share, and this is what I do on my social media, is that these videos that I put together, share them, because you never know who you might help.
Right.
Because back to your point, it could be your next door neighbor that's going through this and you have no idea, because one of the reviews on our book, we haven't figured out who this person is, but he knew Eric over 10 years, but he came out and said, I had no idea what Eric and his family, and he used the word hell, was going through. I had no idea that was going on within their household. So it's,
And I think that speaks volumes about the book, is how much, just the insight, you're like a fly on the wall in your home by reading this book. And
Yeah, well said.
yeah, and I think Garrett mentioned too, like I feel like I'm building a relationship with Eric through the book and through talking with you and just learning about him. And I mean, just like I wish I could have known him.
Yeah.
And I feel like I do, but I wish I could have had that actual relationship with him.
Yeah.
Relationship. We are grateful because of what we learned, and he got clean and sober, that he had 2+ years in our house knowing that he was loved. But there's a lot of parents out there that probably don't even know where their child is right now.
It's true.
Or even if they're alive right now,
It's
because of the addiction that they're going through.
That's true.
And it's tough, but I think we covered good topics.
I do have one more question.
Sure.
Once somebody has reached sobriety, how can they maintain that?
That's a great question. So sobriety and recovery are two different things.
Okay.
Sobriety means being completely abstinent from all substances. That's not recovery.
Okay.
So what's recovery? It's when a person makes a conscious decision to stop using and takes steps necessary to support that. So let's say today I decide to enter recovery. I might go to a treatment program. I'm gonna start going to meetings, maybe start seeing a therapist, right? I'm gonna clean out my house, get everything out of there, not just the alcohol and other drugs, but the paraphernalia, which could mean a crack pipe, a favorite mug, whatever it may be.
Yep.
And then I'm going to tell everyone in my life, I'm in recovery now. Don't bring it around me. Don't offer it to me. Don't be under the influence in my presence. Okay, so what I've done is I made a conscious decision to stop using, and I took steps necessary to support that. That is a whole lot more than just being sober. Okay, so if a person embraces recovery and they do those things and they're consistent about meetings, therapy, doing everything that they've learned to do in a treatment program, they have a very high likelihood of success with this disease. The problem comes in is that over time, people let their guard down. Okay, so maybe they used to go to meetings and now, I'm doing well, I don't need them anymore.
I've heard that routine before.
So the two reasons, and I can tell you this with our patients, the two most common reasons why people relapse, I never went to meetings or I stopped going to meetings. So meetings are not a guarantee, but they are a safety net. So if you're going to meetings and all is well in life, there's still that safety net, because when something difficult happens, now you've got support. If you've stopped going to meetings, what have you got?
And that's what happened. Well, Eric went to meetings, but when he started to go under stress, doctor prescribed him Xanax for stress, which was a mistake.
Right.
Instead of calling his sponsor, he called his dealer. And the fentanyl and the heroin was cut with the fentanyl, and we lost him. But we discussed on the way here, you had a question about the brain development and after?
So, you know, when maybe years after somebody's been in recovery, does what happens to the brain? Does it kind of go back to maybe, what does that look like?
The brain can heal. For sure. The brain can create new pathways over time. They say it takes about up to 2 years for the brain to heal, but it can happen. Okay, so there's hope for sure. The only time it can't happen is when someone has what we call wet brain, in other words, like brain damage from too much use. It's not reversible. They're not going to heal.
Okay. But they would still be, even after 2 years, although their brain is healed, because, I mean, I know people 20 years sober and they've fallen back off.
Yes.
So they're still that, like in their early years, that they are susceptible to falling back into addiction.
Anyone is at any time. You could be sober 40 years. So when you're in remission, when you stop using and you're in recovery, the disease is in your body still. It's in remission, but it's there.
Okay.
So what happens is, if after 30 years you start using again, it's not like you get to start all over. It's still the same body. So it comes out of remission and progresses. Okay.
Interesting.
So
okay.
no one is ever completely cured. This is not a curable disease. It is treatable and it is manageable, but it's not curable. So they will have this disease until they die.
And I've had people that I know who have been sober for 25, 30 years, and they say, I still stay away from certain things because I don't trust myself. I gotta keep away from it.
So I know people in long-term recovery. I've been in this field a long time, so a lot of coworkers and former coworkers are in long-term recovery, and they still go to meetings.
Good for them.
They're doing well.
I think that's amazing.
So for two reasons. One is because it works. It's helping them. But the 12th step is to give back to others. And that's what they're doing by continuing to go and helping newcomers.
Great.
I love that.
Yeah.
That's amazing.
It's a fellowship. It's a true fellowship.
And a lot of organizations that help with recovery and that, a lot of them are former people suffering because they understand it. And that's back to our point is, don't ask somebody who doesn't know addiction for help.
Right.
You got to go to a person who understands this.
Right. And I will tell you, many of our patients, after being here and meeting the staff and meeting our peer recovery specialists, have said, I think this field is for me. So, you know, obviously not right now, but it's a great goal to have for them as they continue in recovery. And some of them might end up working here, who knows?
There you go. So, I like to say, I think as what you've heard today from Lisa, myself, and Emily, this is a disease you don't want to go down, because you just heard how devastating this disease can be and the effect on your child, your loved ones. It's a path you don't want to go through. So educate yourself on what this disease is and understand it.
And come to our family programs if you have any concerns whatsoever, because you will be with a very knowledgeable and kind group of people who know exactly where you're coming from.
Thank you.
All are welcome. So thank you guys for joining, and we will see you soon for our next video.
Thank you.